Hello everyone, I welcome you once more to Idol Talking Lifestyle right here on Awesome Entertainment. And if you haven't subscribed to this YouTube channel yet, kindly tap on the subscription button as you tap on the notification button so that any video that is released in here, you will be able to watch, listen and enjoy. On today with Idol Talking Lifestyle, we are here to talk about health issues right here, and our topic for today's health issue is syphilis. Let's get to know what syphilis is about. Syphilis is a highly contagious disease that's mostly spread through sexual activity, including oral and anal sex. Syphilis was once a major public health threat. It can cause serious long-term problems such as arthritis, brain damage, and blindness. There wasn't an effective treatment until the late 1940s when the antibiotic penicillin was developed. According to the CDC, the rate of new cases of syphilis plummeted in 1990s. 2000, it reached an all-time low since reporting began in 1941, but the disease has been on the increase ever since in 2021. The rate of syphilis in the US reached 1.5 cases per 100,000 people, the highest rate since 1990. This is an overview just of the number. To those who do not understand CDC simply means Center for Disease Control. Syphilis is caused by the bacteria Treponema pallidum. You get it through direct contact with syphilis sore on someone else's body. This usually happens during sexual activity, but the bacteria can also get into your body through cuts on your skin or through your mucous membranes. Syphilis can't be spread by toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, or eating utensils. So therefore, the causes of syphilis is just like that of HIV. According to the latest WHO data published in 2020, syphilis deaths in Ghana reached 483, or 0.28% of total deaths. The age-adjusted death rate is 0.88 per 100,000 of population ranks in Ghana. Someone may stand somewhere to ask, penicillin can be used for the treatment of syphilis? That's very true. Penicillin can be used for the treatment of syphilis. Now let's look at the risk factors of syphilis. You are at a higher risk of getting syphilis if you 1. Have unprotected sex, 2. Have multiple sexual partners, 3. Have HIV, 4. Are a man who have sex with men. Early or primary syphilis. People with primary syphilis get one or more sores called chancres. They are usually small, painless ulcers. They happen on your genitals, on your anus or rectum, or in or around your mouth between 10 or 90 days. That is 3 weeks on average. After you are exposed to the disease, even if you don't treat them, they heal without a scar within 6 weeks. But treatment will keep your disease from moving to the next stage. Secondary syphilis. This stage begins 6 weeks to 6 months after you are exposed. It may last 1 to 3 months. People with secondary syphilis usually get a rosy copper penny rash on the palms of their hands and soles of their feet. They may also have different rashes on other parts of their body. These may look like rashes caused by other diseases. People may have moist, wart-like lesions in their groin, white patches on the inside of their mouth, swollen lymph gland, fever, hair loss, weight loss. That is for secondary syphilis. As for the primary syphilis, symptoms of secondary syphilis will get better without treatment. With the tertiary syphilis, if the infection isn't treated, it may move onto a stage marked by severe problems with your heart, brain, and nerves. You could become paralyzed, blind, or deaf, or get dementia or impotence. It can even be very deadly. Unprotected sex is having sex without using condoms. Whether anal or vaginal sex, once it's without condoms, they are unprotected. There are complications in persons affected with syphilis. These are syphilis complications. If you don't get treatment, syphilis can have complications all over your body. Small bumps. These are bumps called gummas. Others may call it as gammas. They can grow on your skin, bones, or organs. They can destroy the tissue around them as well. The next complication is that your nervous system problems. Syphilis can cause problems like headaches, meningitis, brain damage, paralysis, or hearing and vision loss. The next complication is that you may experience cardiovascular problems. The disease can damage your heart valves or cause bulging blood vessels, also known as aneurysms, or an inflamed aorta, that is aortitis. HIV is also a complication. Syphilis can increase your chance of getting HIV. Syphilis and pregnancy. The CDC, which is the Center for Disease Control, says women should be tested for syphilis at least once during pregnancy. It's best if they are tested at their first prenatal visit. Depending on how long pregnant women have had syphilis, they have a high chance of stillbirth, that is birth of an infant who has died before delivery, or of giving birth to a baby who dies shortly after birth. An infected baby may be born without symptoms but could have them within a few weeks if the disease isn't treated right away. These signs and symptoms can be very serious. Untreated babies may have delays in their development or have seizures or die. When you are infected with syphilis and you don't get treated, the bacteria begin to invade your immune system, which leads to other life-threatening diseases as mentioned earlier. Syphilis diagnosis and tests. When it comes to that, your doctor will need to do a physical exam. They might give you tests including blood tests, which is a quick test at your doctor's office or a public health clinic. This can diagnose syphilis. Another test is the cerebrospinal fluid test. If your doctor thinks you might have neurosyphilis, they will test fluid taken from around your spinal cord. The other one is the dark field microscopy. This is a syphilis bacteria which are visible through a microscope in fluid taken from a skin sore or lymph node. These are how syphilis is diagnosed. We have the RDT, that's the rapid diagnostic test, which is commonly known as VDRL. We also use the cerebrospinal fluid, where we take fluids from spinal cord, and that is very, very painful. Let's come to the syphilis treatment. Syphilis is curable with quick diagnosis and treatment, but if it's treated too late, it can permanently damage your heart and brain even after the infection is gone. If you've had syphilis for less than a year, one dose of penicillin is usually enough to kill the infection. If you are allergic to penicillin, you might get another antibiotic instead, like doxycycline. If you are in a later stage of the disease, you need more doses of it. If you are pregnant and allergic to penicillin, your doctor will probably have you undergo a process called desensitization, which will let you take the drugs safely. Don't have sexual contact until the infection is completely gone. Your sexual partner should also be tested and, if necessary, treated. DAMA, others may call it. People with syphilis have an immune system reaction called Jerichizemia reaction, which is several hours after their first treatment. This might include fever, chills, headache, upset stomach, rash, or joint and muscle pain. These problems usually go away within 24 hours. Let's look at syphilis prevention. You can get syphilis again after treatment kills the infection. To reduce your risk of syphilis infection, don't have intimate contact with someone if you know they are infected. If you don't know whether a sexual partner is infected, use a condom every time you have sex. Syphilis may look like HIV or maybe worse than HIV. Thank you for staying tuned to enjoy today's health talk, which was by Fafa from Outdoor Talk and Lifestyle Group 3. and presented by myself. I am Julius Pyrex. I am on Instagram at Ju_Pyrex. Kindly subscribe to this YouTube channel and also follow us on Instagram at Awesome Entertainment. Thank you. Let's look at what we have next on Health Talk from Outdoor Talking Lifestyle.